there's not a huge amount of funding that's specifically channeled to working at that level, and so it's a really unique platform that allows us to work with those communities and work across countries to understand that community level voice.
Acceptance grants is going to help us to understand the root causes from the perspective of the people bearing the burden directly.
People who are marginalized have specific needs that are different from other people. So if tools assess that need, programs will be able to cater to that need.
What the funding from Sabin allowed us to do was that be able to take everything that we had learned from this area in terms of scaling up mental health and apply it to scaling up uptake and addressing vaccine hesitancy.
Particularly developing these proposals, we have to go through a robust and rigorous searching. Not only that, but also we took the opinion of the experts.
Showing how you can do research, small-scale research in a small context so that you can generate information for that setting and similar settings and then apply it to implementation, I think is great, it's wonderful.
Why the whole communities are not taking, the vaccination program. This is what we want to identify, and also with this program, we want to also share the finding to our leaders, for our policymakers to change the policies.
So if we don't have the data, it is very difficult to create the policies. So that's why I feel when in the government initiatives, when certain things are being done, we need to include marginalized communities also, so that the policies are inclusive and equitable.
We still have, under-immunized and zero-dose children and mixed communities. So this project is going to help show where to find all of these children, what their profiles are, and we can help the health systems.
My personal experience have been get a chance to be in scientific evidence. So I'm very much excited with this issue, and thanks to Sabin for providing the opportunity to perform this kind of research.
Policies get a bad rep because they're dry. Data gets a bad rep because they're dry. And I think it's up to us to do translational research to move away from that.
Everyone should get it and no one should be left behind. And only that can make a true difference, and that's how we want to work. And I'm sure with all the strength and with all the support from stakeholders, like Sabin is there, Gavi is there, WHO is there, so many other stakeholders that are getting involved in this arena. I'm sure this will be quite helpful in making sure that we get to the best of vaccination.